Definition. The common cold, nasopharyngitis, acute viral rhinopharyngitis, acute coryza, or a cold, is a viral infectious disease of the upper respiratory system, caused primarily by rhinoviruses and coronaviruses. Rhinitis is inflammation of the nasal mucosa. Rhinopharyngitis is inflammation of the nasal and pharyngeal mucosa. However, the common cold may be an early sign of another infection, measles or influenza, or may be complicated by a bacterial infection, otitis media or sinusitis. Most common cold are self-diagnosed and self-treated at home. Patients who present with common cold often benefit from reassurance, education, and instructions for symptomatic home treatment. 2. Epidemiology. The incidence of the common cold varies by age. Rates are highest in children younger than 5 years. Children who attend school or daycare are a large reservoir for urus, and they transfer infection to those who care for them. Children have about 3 to 8 viral respiratory illnesses per year. Adolescents and adults have approximately 2 to 4 colds a year, and people older than 60 years have fewer than 1 cold per year. Estimated that up to 75% of children with asthma also have allergic rhinitis. 3. Physiology. Upper respiratory tract. Nasal cavity. Pharynx. Larynx. Lower respiratory tract. Trachea. Primary bronchi. Lung. The common cold virus is transmitted mainly from contact with saliva or nasal secretions of an infected person, either directly when a healthy person breathes in the virus-laden aerosol generated when an infected person coughs or sneezes, or by touching a contaminated surface and then touching the nose or eyes. The major entry point for the virus is normally the nose, but can also be the eyes. In this case, drainage into the nasopharynx would occur through the nasolacrimal duct. From there, it is transported to the back of the nose and the adenoid area. The common cold is self-limiting, and the host's immune system effectively deals with the infection. Within a few days, the body's humoral immune response begins producing specific antibodies that can prevent the virus from infecting cells. Additionally, as part of the cell-mediated immune response, leukocytes destroy the virus through phagocytosis and destroy infected cells to prevent further viral replication. In healthy, immunocompetent individuals, the common cold resolves in 7 days on average. 4. Risk factors. Touching eyes, nose, or mouth with contaminated fingers. Environmental factors such as passive smoking and exposure to pollutants. Low humidity increases viral transmission rates. Spending time in an enclosed area with an infected person or in close contact with an infected person. Lack of breastfeeding. Familial predisposition with immunological defects or anatomical and/or physiological features. V. Causes. Indoor allergens, house dust mite, cockroaches, animal dander, cigarette smoke, hair spray, paint, molds. Pollens, tree pollens in early spring, grass in late spring and early summer, ragweed in late summer and autumn. Multiple environmental factors. Changes in air temperature. 1. History. Patient often reports stuffy nose, sneezing, itching, runny nose, noisy breathing, snoring, cough, halitosis, and repeated throat clearing. Sensation of plugged ears and wheezing may occur. Family history of atopic disease, such as asthma or atopic dermatitis. 2. Physical examination. Runny nose, nasal discharge or obstruction, which may be accompanied by sore throat, fever, core, lacrimation, and diarrhea in infant. Purulent nasal discharge is not indicative of a secondary bacterial infection. In children under 5 years, routinely check the tympanic membranes to look for an associated otitis media. Assess for pneumonia if the child has core or difficult breathing. Assess for streptococcal pharyngitis if the child has a sore throat. Often accompanied by conjunctivitis. It may be the prodromal phase of influenza or measles. Rhinitis and rhinopharyngitis, common cold. 7. Management. Treat at home and parent education. Antibiotic treatment is not recommended. It does not promote recovery nor prevent complications. For high fever or pain, give paracetamol, 60 mg per kilogram per day divided in 4 or 6 divided 4. Clear the nose if discharge interferes with feeding. Nasopharyngeal lavage using a syringe filled with isotonic solution, normosaline 0.9% or ring lactate, 4 to 6 times a day.